Hello, everyone, and welcome to our event on mobility blockers, co-hosted by the National Academy of Social Insurance, the Center for Social Development at Washington University in St. Louis, and us at the Aspen Institute Financial Security Program. I'm Tim Shaw, and I'm the director of the Benefits Transformation Initiative at Aspen FSP. For those of you who are not familiar with us, Aspen FSP equips leaders to support households in achieving their long-term financial security, from establishing financial stability to help everyone in America build the wealth they need to thrive. As a leader of our benefits program, one of our goals is to build a benefit system that supports people across all the benefits that help them afford everyday life, and in between the financial systems and their working life that everyone uses to support their financial stability. Unfortunately, through all of our work across systems, including retirement savings, emergency savings, inclusive financial systems, and public benefits, over and over we have found that asset limits and income cliffs create key barriers to people being able to afford everyday life, save for a rainy day in the long term, and do the work that provides economic mobility. Those of you who are on this call and our speakers later today, many of us have been working on this issue for years. And we've consistently said over time that we know through talking with people who have experienced these conflicts can see the ways that these systems do not work to help people keep the benefits they need while getting a job to get on the economic ladder and create economic mobility. But what we're excited to see is that there's a growing movement of folks who are working together to actually take action on these problems. And we have growing data that actually demonstrates exactly how these systems are impacting people's everyday lives and mobility. So we're excited that we have all of our partners here to speak on these issues, to highlight some of that new data, to hear from employer perspectives about how this is affecting their day-to-day work, and also importantly and critical for us, hear from people who are and stories about people who are affected directly by these policies, because we can't solve those things without working with and hearing from the people directly impacted by those systems. So I will get out of the way and get to our important speakers. I want to thank our partners and speakers, and especially JP Morgan Chase, without whom this work would not be possible. And with that, I want to turn this over to Joe Shapiro from NPR to introduce our opening panel.
Thank you, Tim. I'm pleased to have Logan Archer from, he's a self-advocate from Southeast Texas, working with the ARC, and is an example of exactly what you said, somebody who is faces these issues. And then also, of course, Nan Gibson, the executive director of the JP Morgan Chase Policy Center. Logan, let me start with you. Tell us a little bit about yourself. We're good to have you here. Just briefly, how old are you? And talk about where you live.
Archer, I'm 26 years old. I live in Orange, Texas. It's on the Louisiana border.
Okay. Oh, good. And you were born with cerebral palsy. You get around with a wheelchair, and as a young man with a disability, you get SSI and the Medicaid that comes with it. Tell us a little bit about how SSI and Medicaid, how they're important to you.
So without SSI, without Medicaid, I would not be able to afford the medical bills that come along with, having a disability.
Mm-hmm.
And, with SSI, you can't have over $2,000.
Right.
Because the second you go over $2,000, they penalize you for the next 7 years.
So, and let's talk about, you have a goal, right? You want to start a business? Tell us about this dream of this work you want to do.
So, my goal is to eventually own my own business. Legally own my own business. But as of now, I can't do that. I legally cannot put anything in my name. can't own land, can't own a house, can't own a car, can't own nothing. Can't even pay for the people that come in and help me.
Hmm.
Because the minute I go over $2,000, I lose everything. Insurance, SSI, disability, every bit of it is gone the second I go over. And my dream started when I was in high school.
Yeah. You want to raise livestock, right?
I raised it in high school.
Uh-huh.
I did chickens, and I did a cow most of the year because I had some friends of mine that were really, really good friends, and they said, you ought to show a large animal
Uh-huh.
your senior year. And so they went about doing it. We found one, went and got one, and we did it, And when I got my Lone Star degree, which is at the state level of the FFA, and then
The
three,
Future Farmers of America, FFA.
yes,
Okay.
and then 3 years out of high school, I was the fifth person to get it. Okay, it was my buddies that helped me, and then I was the fifth one in that group. So we went to Indianapolis, Indiana.
Oh, wow.
Uh, this was right before the COVID pandemic.
Yeah.
We went and got it, and I'm proud of that.
So,
And that right there, that organization is basically why
and
I want to do what I want to do.
and it sounds like you found that you have a talent for doing this, for raising livestock and
Well,
animals, right?
because growing up, my stepdad we had uh, Angus. We had cows growing up,
Yeah.
and so it's a hobby. It's a
Uh-huh.
it's a hobby at this point.
And you want to turn it into a career. You want to work, but talk about this barrier that's in the way. You started to tell us a little bit about that SSI asset limit. There's a restriction that it doesn't exist for anybody else who wants to raise
Yeah,
cattle,
like
but it does for you. So talk about what it feels like to live every day under that SSI asset limit.
if it were up to me, okay,
Yeah.
and this is the honest truth. If it were up to me, I would rather work. Okay, I
Yeah.
would work for every dime, nickel, penny. I'd rather work, and like what I'm doing now, I'd rather be getting paid for that than not be getting paid.
Sh-
And I have to watch how much I have in my account. I can't save nothing. I can't have anything in my name. I can't own anything. I'm stuck. I'm stuck not being able to do what I want to do. And it kills me mentally.
Hmm.
Mentally, emotionally, it hurts because I can't. The asset limit cap was put in place in 1989, and it's been at $2,000 ever since,
Mm-hmm.
and nobody's changed it. Nobody's changed it. Nobody's done anything. And when I first got on SSI, I had we said, well, how much is he going to get? And we figured out that they were only going to give me $2,000. My mother point blank goes, "There's no way he can live off $2,000. There's
Right.
no way he can't afford to live off of just $2,000." And so you know,
And I think your frustration is really clear. And by the way, the asset limit, so it stops you from business, but it also stops you from love, right? Because that 2,000 asset limit is just $3,000 for a couple. So tell us what you think about the SSI marriage penalty.
oh my gosh, that right there in itself, it's $3,000. You're right, but the second you get married, you and your spouse your assets diminish to next to nothing. And that is, in all respects, that is unjust, unconstitutional, and just uh, uh, degrading, and it's discriminatory.
Degrading. I like that word. Let me now go to Nan Gibson, who's the executive director of the J.P. Morgan Chase Policy Center. You've heard Logan talk about his frustration here with the asset limit. Tell us, Nan, what's the business case for hiring people with disabilities or helping people like Logan become an entrepreneur?
Yeah, absolutely. And Logan, we would love to help you. So JP Morgan Chase, we operate in all 50 states. We are always looking for top talent in the communities that we serve. And we're also one of the biggest small business lenders. So we're also promoting entrepreneurship in addition to looking to attract and retain the best talent that we have. And we're doing everything we can to make our workplace the best it can be for people with disabilities, which in turn, we know helps us better serve our clients and our customers. So, in today's economy, we and other firms are experiencing, record demand for workers. Our chief economist has recently published some research that shows that there actually has been, amazing growth in the workforce participation of people with disabilities. It's not enough, but the pandemic with the tighter labor markets actually did help draw more people with disabilities into the labor force. But despite some of these bright spots, people with disabilities still continue to face barriers to employment and entrepreneurship along the lines of what Logan has been talking about.
And
yeah,
Nan, if you don't mind me
yeah, go ahead, Logan.
speaking on that just a little bit. See, we can work, but even if we work, we have to be careful of how much that employer is paying us, because it will throw us over the $2,000 limit.
And Logan, that's a good point. I want Nan to talk a little bit about some of the legislation that's come up in Congress, versions of the Savings Penalty Elimination Act. Talk about what it does and why big employers like J.P. Morgan Chase, why would they, why do they care about that?
Right. Well, Logan is absolutely right. I mean, our employees who are on SSI, they worry about losing their benefits if they work too many hours, or, I mean, they're the only people in the firm who worry about getting a raise or a bonus that might put them over the earnings cap. And they're also leaving money on the table because they often can't participate in the company's retirement plan. So that's another disadvantage. And you're right. The reason why we support the Savings Penalty Elimination Act, which has been reintroduced this Congress, is because it will make some common sense reforms to the program. It'll increase, the amount that individuals are able to save for the future. It will virtually eliminate the marriage penalty that's embedded in the legislation, and importantly, it will, keep pace with inflation going forward. So. These are just some common sense, changes that need to happen. And, in fact, our CEO has written about the importance of these changes to SSI in his widely read letter to shareholders. Joe, you've done some great reporting on this as well, which highlighted one of my colleagues, Tabby Haley, and some of the challenges that she's had with the program.
So someone like Logan who wants to work, was actually successful creating a career, and then was thwarted by the Medicaid and SSI rules. Now I'm glad that she's back at J.P. Morgan Chase. Let me ask also, Nan, we've got an audience today of people who know this topic, who care about disability and employment. So what can you tell them? What can they do in this, especially in this current political moment?
Yeah, I would say let your policymakers know about how this is impacting your life, how it's impacting the lives of your family members, and just how it's really impacting, your ability to manage your financial life, whether financial shocks or pursue wealth building or entrepreneurial opportunities. I mean, I would say let policymakers know how this is having real world impacts on people's ability to just really live the American dream.
And
that's something,
yeah,
Joe.
yes, Logan.
And see, that's another thing. The government wants to penalize us for even attempting to live the American dream. We can't. I personally can't have anything whatsoever in my name at all. I can't own a business. I can't even get the funding to own a business. I can't do anything. I'm stuck. I'm stuck at the ground floor. And it hurts. And I know I'm not the only one, because I have two friends of mine, I'm not going to say the names, that are in the same boat. They can't own anything simply because of the $2,000 limit. The limit, and as Nan was sharing, the marriage penalty affects that as well. It all adds up. Every bit of that adds up.
So Logan, I think that's a great, actually, you just gave a great ending. And I'm always going to remember the way you just said that. I'm stuck at the ground floor and it hurts. Thank you. Now I'm going to turn it over to Rebecca Vallis, who's the CEO of the National Academy of Social Insurance.
Thanks so much, Joe. And thank you to Nan and to Logan as well. I can't think of a better way to open this conversation than grounding these issues in the experience that you're sharing with us, Logan. And you're right, you're not alone. It's millions of people who are affected by this asset limit. And Nan, thank you also for sharing the experience at JP Morgan Chase. As Joe mentioned, my name is Rebecca Vallis. I have the privilege of serving as the Chief Executive Officer of the National Academy of Social Insurance. The Academy is a nationwide member network of about 1,300 of the nation's leading experts on social insurance. And I often say I come to this work as a recovering legal aid lawyer who didn't recover very well. It was actually my time representing people impacted by these very barriers to mobility that led me to work on addressing them at the policy and systems level. So I have a lot of gratitude to the Aspen Institute and to our friends at WashU for partnering on these issues and for partnering on this event today. And so to continue the conversation, I'm incredibly excited to segue us to some brand new research coming out of the WashU Center for Social Development, and to introduce a colleague and a new friend working on these issues, Stephen Roll, who is the assistant professor at the Brown School at Washington University. He's also co-director of research and policy innovation at the center, and he's going to walk us through some of the new findings on what asset limits and benefit cliffs mean for the workers like Logan who are affected. So Stephen, over to you, and then looking forward to bringing a whole panel in to react to your new research.
Great. Thank you so much, Rebecca. And I think we'll have some result there. Excellent. So hi, everyone. My role here is to provide some numbers on some of the issues that Logan and Joe and Nan were highlighting. So what are we talking about today is brand new research we have coming out of the Center for Social Development on the impact of benefits cliffs and asset limits on low-wage workers. And if you are interested in this research, like I said, we just published this today, and there should be a link in the chat pointing you towards that research. Next slide. So before I get into the numbers, just a brief word about the project and the data that's supporting this work. So everything I'll be talking about today comes from what we call the Workforce Economic Inclusion and Mobility Survey. So this is a nationally representative survey of adult U.S. workers earning under 250% of the federal poverty line. So broadly speaking, low-wage workers. This is a 3-wave survey that is administered every 6 months. And the results I'll be presenting are from waves 1 and 3 of the survey. The survey was administered by us at the Center for Social Development in partnership with the folks at NORC and was funded by JP Morgan Chase. Next slide. All right, so the central question that we are trying to answer is how many low-wage workers are affected by benefits cliffs and asset limits? And so the way we measured this was for all the low-wage workers in our study, we asked them first if they participated in any of 11 different public benefits programs, SNAP, Medicaid, TANF, SSI, and so on. If they said yes, we asked if they had engaged in any behaviors to limit their incomes or limit their savings in order to maintain their eligibility for those programs. So did you not take on additional hours at work? Did you turn down raises? Did you turn down promotions? Did you keep your savings below an asset limit? Did you not get married in order to maintain your eligibility for these programs? The exact behaviors that were highlighted in the last panel. And what we found was that 22% of low-wage workers on public benefits reported engaging in at least one of these behaviors, most commonly not taking on additional hours at work, keeping their savings below a limit, not taking raises and promotions, and not taking job offers. Now, importantly, we also found that these experiences don't exist in isolation, right? If the average number of behaviors that people engaged in to stay on these benefits was about 2.2. So just to put like a little bit more character on that, if you were a worker who was keeping your savings low in order to maintain eligibility for a program, you are also extremely likely to report also, turning down a raise, turning down a promotion, turning down hours. So you're simultaneously having to limit your savings and limit your income in order to maintain eligibility for these programs. And of course, when you think about it, like these are the two primary ways that people have to escape poverty, right? I mean, increasing your earnings or increasing your savings for things like college or home ownership or long-term investment or business startups, right? These are our paths out of poverty. And we have a huge number of workers reporting that they're having to just forego earnings and forego savings just to maintain their eligibility for often life-saving benefits. We also asked these workers, okay, well, when you engaged in these behaviors, what programs were you trying to stay on when you took these actions? And we found that a quarter of those on TANF said that they were engaging in these behaviors to maintain their eligibility, about a fifth of those on housing subsidies, a fifth of those on SSDI, and about 13 to 14% of those on SNAP and Medicaid were limiting their income or limiting their assets in order to stay on those programs. Next slide. So we are also interested in how much these were costing. These behaviors were costing workers, right? We've talked about the numbers, how many workers are being affected, but what is the actual cost of these decisions to these workers? And what we found is that the median worker affected by benefits cliffs reports losing 6 to 10 hours of work a week, because they just can't take on those hours in order to maintain their eligibility. That translates to hundreds of hours of lost labor a year. Of course, that also comes with lost wages, right? So we asked workers, okay, well, how much money are you giving up in order to maintain eligibility for these benefits? And we found median worker also reported losing between $500 and $1,000 a week. So we're talking thousands of dollars a year, tens of thousands of dollars a year, in some cases, simply to stay on benefits. Next slide. But beyond just the financial costs, we also measured some other we think, adverse experiences associated with trying to maintain eligibility for public benefits. We found that a third of low-wage workers reported being worried about losing their eligibility. And relatedly, only half of workers on benefits were even confident that they understood the eligibility rules. So they're concerned about it, but they lack even the basic knowledge of like, okay, what actually is the limit? What are these cutoffs, right? Next slide. So anyway, this is just the summary slide, right? The basic takeaways here are that, we see large numbers of workers on benefits. 22% of low-wage workers on benefits faced at least one cliff effect. This translates to 10% of the entire low-wage workforce, and that multiple cliff effects were common on savings, on income, on other behaviors, which is likely magnifying these economic distortions. And these cliffs are incredibly costly, yes, to the workers, but also presumably to the employers who would like their workers to work more hours, to take the jobs that are the best fit for them, right? This is a decrease in productivity, as well as to those communities that are supporting the workers. And then workers report high levels of uncertainty and anxiety in managing their benefits cliffs, or managing their eligibility for benefits. And yeah, that's it. So thank you so much. And with that, I'll turn it back over to Rebecca.
Thanks so much for that, Stephen. And I'm seeing the rest of our panel emerging on the virtual stage. So I'm going to go ahead and introduce them. And we've got just a really wonderful set of leaders on this issue here to both react to your research and also to really put it in context and to bridge it to the first conversation that we just heard with Joe and Logan and Nan. And so some quick introductions, and then we'll get into the conversation. Really thrilled to have with us Shoshana Martyr, who is the Executive Director of the LEAP Fund. Shoshana, so glad to have you here, and so glad we'll get to hear about LEAP's wonderful work on these issues. And Jason Tisco, who's the Senior Vice President of Policy and Programs at the U.S. Chamber of Commerce Foundation. It's been wonderful getting to partner with the Chamber, given that these are really workforce issues and really are affecting businesses, and we'll hear about that from you as well, Jason. So just to kind of kick us off, we just heard some really timely, really important new research from Stephen, which maybe tells us things we already know anecdotally, but it's always so helpful to have numbers that put what are not individual issues, as Logan said, right? He knows he's not the only person affected by this stuff, to put those individual stories in context. And so I'd love to give Jason and Shoshana, both of you, an opportunity to react to Stephen's research from WashU and to kind of bring your perspectives to this problem. And so, Jason, starting with you, help us understand how you're thinking about this at the Chamber and the Chamber Foundation, and kind of why businesses care about this issue and should care. Nan got us started on that front, but I'd love to give you an opening as well now with the context that Stephen shared.
Great. Thank you, Rebecca. And yeah, I work for both the Chamber, which is the world's largest business federation, as well as the Chamber Foundation, its nonprofit affiliate. And I work on all things education and workforce development. And looking at the data that was just shared and kind of comparing it to a lot of the challenges I deal with on the labor market side, the things that we're thinking about within the business community is, looking long term where our demographic trends are. We are going to have a shrinking workforce. So we are going to have to do more with less. That's just a fact. And that's going to hit certain labor market sheds much harder than other ones, but we're all moving in that direction. So knowing that context, and it's not just a skills gap issue that needs to be addressed in a dynamic economy, but it's a people gap issue. Carrying that conversation we're having over here to the benefit cliff one, you can begin to see how this is really a business imperative now, because we cannot be disincentivizing people to work. And we need everybody who wants to work to have the ability to work and to engage meaningfully in the economy. So as a sheer just human capital challenge that we have as a country going forward, if we're going to want business to be successful, to be competitive, to grow, and by virtue of that, for the U.S. economy to grow and for us all to benefit from that growth, it's going to require full mobilization of the available workforce. So there's many different ways we could approach this conversation, and it really resonated with me what Logan was sharing, in humanizing this, and and what Joe had shared about it's against love. Like, these are like really important kind of moral questions we need to have, but I would like to bring an economic argument to it as well.
Yeah, and I so appreciate that, Jason. And Shoshana, this is where I want to bring you in as well. LEAP works directly with employers because there is a lot that can be done to work within the current rules, but obviously, that's not enough, and we've got policy fixes that need to happen too. We'll talk about that too. Talk a little bit about LEAP. Talk a little bit about what you all see, kind of on the ground level, working with folks to try to address the benefit cliffs and asset limits that people face in ways that help people stay attached to the workforce and stay attached to benefits.
Yeah, absolutely. Thank you, Rebecca. And hello, everyone. Shoshana, Executive Director at Leap Fund, and we're all about tackling benefits cliffs. So our signature program is our Benefits Cliff Coaching Program, where we actually work with nonprofits and train their staff in how to talk about benefits cliffs with clients. And we've also done work, as Rebecca was saying, with employers to engage them as just an important stakeholder in this conversation around benefits cliffs, how it impacts them and how it impacts their workers. I think what Stephen was highlighting in his research is really two big pieces here. One, we're seeing that benefits cliffs are impacting the choices that folks are making. Stephen had that number, 22%. We're facing that cliff effect. We're making decisions around it. We're seeing similar data. Community Service Society of New York City just published our survey result that showed that 1/3 of folks in New York City we're making decisions to avoid hitting that. In our own data, we're seeing of those who are aware of benefits cliffs, over half were making decisions. So this is a real thing that's impacting the choices that people are making. And I think the other piece to highlight is that uncertainty piece. Benefits cliffs are real and people are hitting these cliffs, but there's also just so much misinformation out there around when someone's going to hit a benefits cliff that people are often forced to make decisions out of fear, not knowing. So people will not take that job, not take that raise because they have no idea how it's going to impact these really critical public benefits. So it's these actual benefits cliffs and asset limits that we need to change, and also this lack of transparency that needs to change. We've done a lot of work around this transparency piece. How can we provide this vital information so people can make informed decisions and plan ahead for their career and their future? But all these learning, all these stories, the ultimate goal is how do we channel that upwards to make some real policy change so that people don't need to be forced to make these impossible choices.
Yeah, I so appreciate that, Shoshana. And the transparency piece is obviously big, but even when there's transparency, as you all often talk about, there's so much complexity. You can know what all the rules are and still not be able to do all the jujitsu to fit within them, right? And different programs might have different, limits and different policies. And so it can be really hard to put into practice, even if you know what the rules are and are trying to do everything right. So Stephen, I kind of want to bring you back in here because you got to walk us through the top lines, but Shoshana really just hit on what I think is one of the really big takeaways of your research, which is that people are actually making different choices than the ones that they want to make and that might be right for their families and for their households because of these government barriers to work and to savings. Talk a little bit more about what you see as some of the implications of the research and what you're hoping people take away from it.
Yeah, so thanks for that, Rebecca. I do think that the first thing that Shoshana highlighted that's hugely important here is this total lack of clarity and certainty around these benefits, right? I mean, it's even as someone that works in this space and as a researcher that works in this space, trying to wrap my head around all the eligibility rules and cutoffs and, oh, does a vehicle count as an asset in this program? Does a vehicle not count as an asset in this program? And all that. It's incredibly complex, right? I mean, imagine, you're feeling and you're filing your taxes. Just if you have very simple tax reform, you're not gonna you as someone with a very simple tax return is not going to understand in advance like what your tax return is going to be, what you're going to owe, what your refund is going to be, and so on and so forth. For someone on public benefits, right? It's like trying to navigate a bunch of different tax rates simultaneously, a bunch of different requirements simultaneously. And, if I misestimate my withholding right? I might owe a bit more in taxes than I originally thought. If someone on Medicaid misestimates, how much they can have in savings, they could lose access to tens of thousands of dollars worth of health benefits, right? So this is a huge, huge issue. And when you look at other research on people's how people perceive these benefits, especially around these benefits limits, benefits cliffs, asset limits, you see that they're incredibly risk averse. So people make assumptions like if I even have a bank account, I might lose access to Medicaid. Or, maybe Medicaid's asset limits are actually $2,000, but people perceive them. They say, oh, if I get any more than $100, they're just going to kick me off the program, right? And in some sense, that's incredible. That's a very rational perspective, right? Like the risk of saving an additional $1,000 or the benefit of saving an additional $1,000 is much less than the risk of being kicked off Medicaid, being kicked off SSI, and so on. And so you have, this entire cohort of people, millions of people, who are making incredibly risk-averse decisions around savings and around income, that's limiting our labor force participation, that's limiting their well-being, and I don't think really benefits anybody. And so the simplest implication here, I think, is that we need to streamline these eligibility rules. We need to improve information sharing. We need to improve awareness of these cliffs and limits, yes, but also that we should take some pretty substantial steps to try to either eliminate them entirely in many cases, or at the very least, like make them less or decrease the penalty, like soften the phase out ranges, remove cliffs entirely.
Yeah, I appreciate that, Stephen. And, just to say, there's been a range of public opinion research on these issues. And when you ask the American people what they want to see, a lot of people say actually one of the most common responses is just eliminate these policies. They don't make any sense. And you see that from Republicans, you see that from Democrats, from independents. When you explain something like this, people go, whoa, why are we telling people not to save? That doesn't make any sense. Why are we penalizing people for working? That's counterintuitive. Right? So I think what you just said is also backed by really a huge share of the American public. So I want to go back to you, Jason, because I feel like Nan spoke beautifully about some of what Jamie Dimon and the JP Morgan Chase team thinks about these issues and some of why they have been so engaged, especially on trying to update the SSI asset limit, which Logan was speaking about. But one of the things that hasn't come up yet, and which I'd love for you to talk a little bit about, is how things like asset limits prevent people who are in the workforce from participating in basic employer provided benefits like 401ks. This is something people often don't know much about, but it's something that I know the Chamber has been looking into.
Yeah, and the business community can be a powerful advocate here, and it does take some education. And I think through networks like the Chambers Federation of State and Local Chambers of Commerce, we are up to over 1,500, have a collective reach of over 3 million firms. There's a lot we could do to really get employers not only educated on this issue, but to give them the tools they need to mobilize and take action, whether that's at the federal level or the state level. And so I encourage, one big takeaway I want to give to this group is activate employers will help. And we're glad that JP Morgan has kind of stood up and taken a leadership position on this issue. But I think we need to look across all the various benefits and the cliffs associated with them to kind of figure out where can business kind of more tactically engage to try to maybe get some of the most severe cliffs off the table. And I think, how we manage assets is one of them. In fact, one of the innovations that we're very excited to be pursuing now is this new concept called a skill savings account. Imagine like an HSA or an FSA, but for skills. And we want to actually bring this innovation to the American workforce because we want to build their resiliency in a dynamic economy. And we think that's a great way for employers to be making contributions with their employees to dynamically upskill and reskill as the economy is going, or as the economy writ large is going to continue to change and jobs are going to change. Well, the last thing we're going to want is to provide people with more assets so they can be more resilient and stay competitive, and that have that potentially trigger a cliff. So it's not even just, the cliffs we're dealing with, given the assets people have now or don't have, but the innovations we're trying to bring going forward could exacerbate some of these cliff issues. So I think we just need to have a broader education about these things and figure out how to tackle them. But, for the business community, it's not only that we want more people participating meaningfully in the labor market because we don't have enough people to do the jobs we have and we want to grow, but there's the issue of we want to make sure that the workforce is resilient. So we want them to have assets that improves their resilience, their staying power in the labor market, and we want those good outcomes. So I think this is just a ripe area for more business engagement and advocacy. And I'd be happy to start connecting the dots amongst the chamber community, but would love to work with Shoshana, with the JP Morgans of the world to figure out how it could be a collective effort to really leverage the business voice here.
That's great. Thanks so much for that, Jason. And you're absolutely right. Business is a really powerful voice, and there is a lot that's ripe for reform right now. And so having your engagement and your call to action there, I think, is incredibly timely. And also just appreciate your bringing in, right, some of the innovation that you all are trying to focus on. But with these types of barriers to mobility, or mobility blockers, as I think we're calling them in today's event, these are barriers to both the things that already exist on the books, like 401ks, but also the types of innovative solutions that you all are bringing to bear, getting in the way. So Shoshana, back over to you. You were starting to speak before about some of the work that you're doing with employers, but you also started to talk about how what we really need is policy change. And I feel like this panel is starting to segue into that direction. So would love to have you sort of bridge us into talking more directly about what should advocates, what should policymakers who are listening take away, and what should employers who are hearing Jason's call to action and saying, all right, this is something for me to show up on. What is the call to action when it comes to the policy change and the solutions we need?
Yeah, absolutely. And it might be helpful to ground it a little bit in like, why now? Like, why is now the moment to be talking about this? And I will say there's really two pieces here. First of all, this is particularly critical right now. We're in a moment where benefits are under attack, and proposed changes are likely to make this worse, are likely to exacerbate benefits cliffs, where there's just more economic uncertainty, which means likely more people are going to be receiving or needing to receive public benefits. And just because of that uncertainty means more fear driving these decision makings. We're also seeing a lot of momentum right now. There's a lot more community-based organizations that are talking about this, a lot more data and research and advocacy groups that are talking about this. And as you were pointing out this before, like, everyone agrees this is a ridiculous issue. So this is a moment where we might actually be able to get some real things done. It's needed, and there's the momentum to do it. How we kind of think about, like, what are the different changes that needs to be made, and I think this is actually just highlighting everything that's been said so far. We look at that transparency and ways to mitigate, bridge, and eliminate these cliffs. So first, how can we provide more transparency, which Rebecca to highlight will not solve this, but how do we at least give people information so they can make informed decisions? Yeah. There's projects like we're doing, but also like Love My Job shouldn't have to do it. How can the government itself and these benefits agencies provide this level of transparency? There's different policy solutions to help mitigate these benefit cliffs, even if they don't eliminate it altogether. As an example, New York State passed a bill last year, the income disregard bill, that helps mitigate these cliffs for people receiving TANF after being in a work training program for like 6 months. So it, again, in no way solves benefits cliffs for people who receive TANF, but there is a group of people who now are able to have that 6 months to take that job and earn until they're able to hopefully be able to bridge that cliff. And there's different pilots out there that are doing that bridging work, that are either providing cash or other resources to help folks bridge that benefits cliffs, and when they lose that benefits, give them those resources to balance that out. And all this can make real change and impact in people's lives, with that ultimate goal of how do we just eliminate this altogether. That might involve, because this is also how benefits are interacting with each other, some pretty significant changes to the benefit system. But I think ultimately we really have to think, like, this system isn't working. How can we fix this system so that people aren't trapped, aren't stuck on the ground floor, as Logan was saying?
Yep. No, and those words are going to stick with me, Logan, right? I'm stuck on the ground floor, right? I think that's really the thing everyone's going to remember and take away today. And Shoshana, I also appreciate you saying we all got to help put you out of work, right? Because that's what you're trying to do fundamentally over there. I feel like that's what I used to say when I was a legal aid lawyer. I was trying to put myself out of work. Stephen, I want to take the same question to you. You sort of started to take us there, but if you want to react to any of what Shoshana shared, and also, we heard about the SSI Savings Penalty Elimination Act on the first panel, which is a very real-time, bipartisan-backed opportunity that would do a lot to update asset limits. It wouldn't eliminate them entirely. What are you hoping that folks take away in terms of specific policy reforms or solutions that you'd like to see gain more traction coming out of this research and this conversation?
Yeah, thank you for that. So, I mean, what I would like to see coming out of not just this conversation, but the broader conversation about like what a more humane and what a more humane benefit system could look like, but also what a benefit system could look like that actually promotes economic mobility, would be for, our policymakers and our policy system to have just some agreement about what we're actually trying to promote people to be able to do. Right. So when I think about Logan and Logan's situation, I ask myself, who's possibly benefiting from this? Who is possibly benefiting from this arrangement where you have, this young man who wants to start a business, and simply cannot, because he can't save enough to get the financing, because even if he did, he might earn too much, in order to maintain eligibility for these life-saving, in many cases, benefits. Who is this serving, right? And I don't think it's really serving anyone, right? It's actually hindering the economic mobility of Logan. It's hindering the economic mobility of millions of people. And you look at what our government is trying to do in terms of promoting savings more generally. And you think about there's the recently passed Secure 2.0 Act, which provided a lot of really positive savings incentives for low-income households, right? Matches on savings programs, allowing employers to create emergency savings accounts on behalf of their employees and things like that. Great innovations, right? But again, we have a policy system that prevents millions of people from actually benefiting from those policy changes, and probably the millions of people that could stand to benefit the most from those policy changes. And so, broadly speaking, we have a typical understanding of what we think of as like the American dream, right? It's some combination of like an upwardly mobile career path, entrepreneurship, and home ownership, and being able to, save for your family and save intergenerationally. And we've built this really elaborate and confusing and sometimes cruel system of asset limits in particular that just keep people from doing any of that out of a fear that, someone somewhere might save, $8,000. And so we kick people off Medicaid and kick people off SSI because of that, right? And so just coming to some sort of broad-based agreement as a society, as policymakers, as a policy system, that probably having really onerous restrictions on people's savings, on people's assets, is not really benefiting anyone whatsoever. And thinking really critically about how we can substantially lessen or eliminate these limits so that people like Logan and the millions of people like him can actually fully participate in society.
Yeah, and I also have your words, Shoshana, is kind of sticking in my ears as well, right? Mitigating, bridging, eliminating, and one of the policy reform adaptations of some of what I hear in that mantra is some of what Stephen is talking about, right? There might be updating and eliminating the limits themselves as sort of a North Star, but then there's also a momentum growing around the idea of excluding certain types of things like retirement retirement accounts from counting against asset limits, right? So that as we work towards the bigger picture solutions that everybody agrees on in concept, we start to remove some of those barriers along the way and mitigate the harm. So we've got a couple of questions coming in from the audience, and I want to encourage, if we've got others, we do have a few more minutes, so feel free to toss a question to the chat or the Q&A function, and we're going to go to one just right now in a moment. But Jason, I just want to give you a chance to weigh in on the same question as well. The Chamber is a big supporter of the SSI Savings Penalty Elimination Act, that specific piece of legislation that was mentioned in the first panel. And is there anything else you want to say on what should advocates and policymakers be thinking about, and specifically policymakers from this conversation today?
Yeah, I just reinforce a prior point about building resilience in the workforce, and retirement certainly a big piece of that. Like, that we should get everything out of the way for that would prevent someone from meaningfully saving for retirement, so they can, retire with economic security. And some of these things I think are going to be no-brainers. We just have to engage in collective action to get it done. And I think another thing that could just be useful is, there's a lot of bipartisan support for like the earned income tax credit. And like there you have kind of and it can be improved, no doubt, but it was well designed to kind of phase out.
Yeah.
And if we take lessons learned from that and just start applying it to other spaces, like we know how to design a well-functioning solution or to make it better. So I think that pointing to precedent where we have figured it out and trying to carry those lessons learned and best practices to other policy, I think could make this more concrete. And I think we just got to get specific. We got to figure out, what's the top 3 to 5 things we need to do first to address the most severe cliffs, or where there's kind of low-hanging fruit opportunity and wide consensus, but for a little bit more effort. And once we get that list, I think we could go and take action. But, point to past success, and then get focused on, instead of boiling the ocean, what's 3 to 5 things we could do right now that would make a big difference. And I think there's a lot of common ground on just like Stephen was saying, there's these areas where nobody benefits from the way this is designed. So let's get to work.
Yeah, I love that. What a great pitch, and a really good segue into one of the questions that actually just came through. And I think I'll expand it a little bit to help it fit to some of what you just said. So we have a questioner who says, do other countries have these kinds of mobility blockers tied to social benefits? And if so, how do they address it? If not, how are benefits structured in other countries to prevent this problem? And I feel like part of what you were just saying, Jason, actually speaks to this, which is we also have US precedent for doing benefits delivery or policy design better, right? And the EITC is, again, not perfect, but a great example of trying to actually do this a little bit better so that people can transition to more and more work, and in a way that doesn't cause them to lose in the process. I'm curious, Stephen, if you have any insight you want to offer in terms of international comparisons, or if Shoshana or Jason does as well.
As a researcher, I always like to be clear with the limits of what I know, and I'm definitely not an expert on, benefit systems in other countries. What I will say is that one of the, I think, key trade-offs that people on benefits in the US have to make around this is, do I want to earn more, or do I want to have health care? Right? Do I want to continue to maintain my access to Medicaid? Do I want to save for a small business, or do I want to lose, treatment for my chronic disease, right? That is a trade-off that people have to make here that they don't have to make in other countries, right? Or in many other countries, because healthcare is universal. And, if we want to structure our public healthcare system like this, right, where you only qualify for publicly sponsored healthcare if you meet certain income criteria, okay. But I mean, we need to be clear about the trade-offs that we're imposing on people, which are the trade-offs between, earning more, working more hours, saving more, and having reliable health care for their children, for their families, or for their chronic issues. So that's one key distinction between the US and many other countries.
Shoshana, anything you want to add, or Jason, on that front? And it doesn't just have to be international comparisons. Just happy to throw that to you as well, in case there's anything you want to add.
Yeah, I don't have an international comparison, but something Stephen mentioned kind of resonated with me, this idea of like the trade-offs. And part of what, it makes me think, like even an organization like the US Chamber, like we are compartmentalized by topics. I'm the workforce guy. We have wage and hour people. We have people working on healthcare. You name the topic. We've got an expert, but we tend to get captured by, our own silos. And when Stephen was going over some of the earlier data, a lot of people face more than one cliff, but are the people that are kind of the experts in their space talking with others, where for the individual user, like this is all converging on a person or a family. But we tend to kind of treat these things as siloed policies and programs with different experts and researchers tied to them. So I think that's one of the ways that we might be able to make some progress on this front, is break down those silos and start having a conversation across departments, divisions, to say, my policy is going to affect your policy, but I really have to be intentional about reaching out and talking to you about that. Otherwise, we're going to have like horse blinders on, and we're not going to see how a decision here is going to impact someone's prior decision over there. So that trade-off thing just really resonated, and I think it's something that we should kind of take with us and say, hey, we need to be talking across these cliffs, knowing that there are often different communities that might not regularly communicate with each other, and we got to break those silos down.
Wonderfully said, Jason. And, I often think about my legal aid clients, right? Life doesn't happen in silos to people who are actually impacted by and living policy, right? And so we shouldn't be thinking about it when we design policies in silos either, in that way. So we've got just a few more minutes left, and we've got two more questions, and I'm going to see if we can get these in before we wrap. One is, it seems that the most valuable lost benefit is medical insurance. And Logan spoke a lot about that earlier, right? It's not just the SSI that is at risk. We often hear this among SSI beneficiaries. It's the Medicaid that comes with it that people really can't afford to lose. Is there evidence, the questioner says, that workers whose access to employer provided insurance are less worried about cliffs and therefore are more likely to accept raises that qualify them for insurance? And I'm curious, Stephen, if you have any thoughts on that from your research.
I mean, my first thought is I think that's very likely. In terms of what the actual evidence says, we don't know. There's surprisingly not that much like quantitative, rigorous research out there on the impact of these cliffs on people's decision making and well-being. You see a lot of great studies out there on, what the actual like costs of these cliffs are in terms of, how much people would have to make in order to actually experience like a net inflow of resources given the lost benefits. But I think we're still in the pretty early stages of developing like a really solid evidence base on the true costs of these things. So it's a really good question, but I don't have concrete numbers behind it.
I always do love opportunities, though, for adding to the wish list on future research, since I know you guys are definitely thinking about what's to come. We've got one more question, which I think I'll give one sentence to, and then I'll be a good steward of time and wrap us up. But I do want to speak to this questioner as well. Someone asks about ABLE accounts. Have ABLE accounts been helpful in allowing people with disabilities to save and hopefully to reach educational and entrepreneurship aspirations? What are some limitations of ABLE accounts as a mechanism for getting around asset limits and benefit cliffs? So not a lot of time to go into what ABLE accounts are, but just to say, I think this fits in that framework that Shoshana offered of mitigation. A great first step that some people have taken, some policymakers have taken to establish a special type of account that people can go through steps to open, and then to have certain types of savings in that account. But it doesn't address that root cause. And so a step that allows for some mitigation for people who are able to get help in opening a special account, but again, doesn't solve that root cause. And so the limitation to that point in the question is that almost no one has actually been able to set up ABLE accounts. It's about 1%, according to some of the most recent data I have seen, of eligible people, because you pretty much, need a lawyer and an accountant and lots of other, supports to be able to do something quite complex like that. And so my understanding is actually Logan doesn't have an ABLE account, right? Lots of people don't and aren't able to. So an important step, and also doesn't solve that root cause. So I think with that, I'm going to try and wrap us up here. I know we could probably spend 3 more hours and still have lots more to talk to and have lots of good questions coming in from the audience, but that's why I'm really glad that this is just one piece of collaboration between the National Academy of Social Insurance, the WashU Center for Social Development, and the Aspen Institute continuing to work together on these issues. So lots more to come from all of us on opportunities to continue to seize and forward and build on the momentum folks have been talking about. And I just want to thank Jason Tisco from the Chamber, Shoshana Martyr trying to put herself out of work at the LEAP Fund, Stephen Roll putting out really important and wonderful research that I know we'll see lots more of from the Center for Social Development at WashU. And I want to thank Joe Shapiro at NPR, Nan Gibson at JP Morgan Chase's Policy Center, and probably most importantly today, Logan Archer speaking about how these issues have impacted him personally. Big thanks to the Aspen Financial Security Program for your partnership and to WashU. And thanks everyone in cyberspace for joining us today. Appreciate your time.